Our case study is a preschool boy with asthma. Asthma is a respiratory condition that causes difficulty breathing. Um, and it's triggered by allergens, exercise, and the environment. For some, it is a minor condition that is well maintained and hardly affects daily living, while others can experience major life-threatening attacks of asthma that interfere with everyday life. Asthma is characterized by narrowing of the airway. Signs and symptoms include shortness of breath, chest tightness, wheezing on exhale, trouble sleeping, and coughing. The effects of asthma are different for every individual. Some risk factors include having a relative with asthma, having allergic conditions, being overweight, and being a smoker or secondhand smoke. Um, Long-term treatment is inhaled corticosteroids, leukotriene modifiers, combination inhalers, and theophylline, and those are taken daily to prevent asthma attacks. And then you can also take rescue medications in case of an acute asthma attack for symptom relief. First line is quick relief bronchodilators, particularly albuterol, which is a short-acting beta agonist. You can also give anticholinergic agents, including ipratropium, tiotropium, and they act quickly to relax your airways, making it easier to breathe. And then corticosteroids can be used to relieve the airway inflammation. Um, it is also important to know how to prevent your asthma through following your asthma action plan and then getting vaccinated for flu and pneumonia, and then identifying your triggers so you can avoid them.
So our nursing diagnosis one for the child is impaired health literacy related to limited understanding of asthma and its management as evidenced by need for age-appropriate education about breathing treatments. This health literacy highlights the need for age-appropriate teaching to help them understand the basic care and breathing treatments through play and simple language. Our nursing diagnosis two for the parents is deficient knowledge related to asthma management and environmental triggers as evidenced by parental questions about medications used in home care. In this scenario, if the parents are asking questions, it's important to educate the caregivers on medication use, recognizing the triggers, and creating a safe home environment. And in the scenario three, we have readiness for enhanced family health management related to desire to improve asthma control as evidenced by expressed interest and eagerness. So in this scenario, if the family is showing readiness to help their child's asthma, it reflects their motivation to learn and establish healthy routines that support long-term asthma control and the ability to control the condition as a family unit.
So growth and development in a preschool aged child without any sort of condition for their gross motor skills, they're going to experience an increased and improved coordination and control of the large muscle groups. Some examples of things that they'll be able to do better than they would before this age group would be jumping, climbing, riding on a tricycle, hopping on one foot, some basic skipping. Those are all gross motor skills that they would know. They're also learning how to throw and catch better. They're learning to time things as they're coming in when they're trying to catch them. And one important note for this is that these large muscle groups must be exercised regularly in order to make sure that these large muscle groups are strengthened. Fine motor control continues to improve, specifically hand-eye coordination. Preschoolers are beginning to draw shapes and simple images of people, specifically themselves. They're using pens and scissors properly. They're printing letters, and then they're drawing some basic scenery with basic trees, sky, and the sun. Children are learning to dress themselves. They're able to better use buttons on their shirts and on their pants. They can do basic forms of putting on their shoes, whether that is with the Velcro strap or they're learning to tie their shoes, although mastery of that skill does come at a later age. In terms of their cognitive skills, they're in the pre-operational stage. This means that they are more egocentric. They have magical thinking. They are unable to think of things from other people's perspectives as much as their own. This is why they can have a difficult time when people tell them they can't do something that they themselves think is fine. Basic concepts that they're learning would be colors, counting, and the concept of time. So yesterday, today, tomorrow, things like that. The vocabulary of a preschooler is rapidly expanding up to 2,000 words. They can begin storytelling. They can use more complete sentences and follow multi-step directions, about 2 or 3 different steps in that multi-step direction. And then lastly, their psychosocial development. According to Erickson, these preschoolers are in the stage of initiative versus guilt. Preschoolers are very eager to try new things, specifically so that they can become independent while they're doing so. They enjoy learning social rules, and their associative play will then develop into cooperative play as they learn more social skills with their peers. And it's important for them to feel success and initiative, or else they might feel guilt. The impact of the medical diagnosis of asthma on these developmental skills. For the gross skills, there is a possibility of reduction of the development of these skills due to the fact that young people with asthma are not able to participate in as many physical activities due to their symptoms of their asthma. For fine motor skills, these aren't directly affected, but there can be an indirect impact because asthma, being hospitalized, missing school time, or whatever it may be, can limit the amount of time that these individuals are able to refine those skills. For cognitive skills, it's a similar story. The cognitive processes are not directly affected by asthma, but treatment in the hospital, secondary effects such as missing school time, can have an impact as children are not in the correct cognitive developmental level. For language, it's a very similar story. Again, there is no direct effect on the language development because of asthma. But if children are not able to participate in as many activities, as many social environments, are not able to go to school, there may be a reduction in these linguistic opportunities. And then lastly, psychosocial growth may be hindered by asthma because children are not able to participate in certain activities such as sports. Sports are a very important part for many young children because they allow for teamwork to grow, for determination to grow. This can lead to an increased fear and anxiety and an overall reduction in self-confidence for these children.
So our creative teaching mechanism for this preschool boy is to help him understand the importance of using his inhaler. We're going to use this by implementing a asthma hero training mission. And how he's going to work it is we are going to tell the preschooler that he will become a superhero in his training and that his inhaler is his power puffer. This mechanism will help him breathe like a hero. So whenever he gets tired from smoke, dust, or running too fast, he can use his power puffer, which gives his lungs the superpower of air to help him feel strong and fast. The cognitive level approach teaching strategies we decided to implement is play-based learning, so using something like a doll or a stuffed animal role play, visual support, so using emotional faces like the Wong Baker scale or the nurse's own emotional faces can help him understand emotions. Trigger charts and a visual schedule, these can help him use a physical reminder to his exacerbations or his triggers. And you building routines like a consistent check-in or breathing treatment routines. Something like a sticker chart can help them to keep track of their maintenance doses as well as feel accomplished with their streak going on. And having consistent routine allows the child to learn how and when to do their medications as well as use their peak flow meter. The rationale for our teaching strategies we implemented. The play-based learning strategy helps the child understand and accept asthma care through developmentally appropriate, engaging play. So using something like dolls or stuffed animals, as I mentioned earlier, can help make learning less scary and more fun as they can understand the treatment better. The visual supports enhance not only their understanding, but the recall of asthma triggers and routines using their visual cues. These parents will also benefit from this because it can give them easy to remember visuals like a trigger chart that they can remember easier than just a brochure. And building routines promotes consistency and family participation while supporting adherence to daily asthma management. The daily routines help create structure, which reduce confusion and anxiety and complete the family as they come together to support an asthma care. And here's our references. Thank you.